Trust Once Lost. Supplemental patient notes. Made by the author Greenhorne himself.
A human nurse told a mysterious figure they could make him a mare. This is what happened to his body. Green is a unicorn filly presenting to the emergency room with a reduced level of consciousness, a fractured right foreleg, and multiple other minor injuries. 3 fillies tell the admitting nurse that they found Green injured in the Everfree forest. Green was confused and disoriented, but once they convinced her to follow them, she limped for about 10 miles before collapsing. The 3 fillies loaded her into a cart and rushed her to the emergency room, where we are now. Given her lack of medical history, we lack important clues that could explain her condition. The emergency doctor orders a full physical examination and samples of her blood and urine to be sent to the lab for analysis. On examination, her heart rate is elevated at over 100 beats per minute. Her breathing rate is also high, and she has a low-grade fever. Her coat is warm and sweaty to the touch, and she appears significantly underweight. Green's leg is obviously broken, but right now that isn't the greatest concern. Green has a reduced level of consciousness. Level of consciousness is a term medical professionals use to describe how responsive a patient is to their environment. Level of consciousness is assessed using a tool called the Glasgow Coma Scale. A patient who was alert and oriented would have a GCS of 15, while a 3 would indicate they were completely comatose and couldn't respond at all. Green won't wake up when ponies ask her to open her eyes, but she withdraws her limbs in response to pain and makes incoherent sounds. Her GCS score is 9. This, combined with the reports from her rescuers that she was confused and disoriented, tell us that her brain is not functioning properly. If Green received head trauma when she injured her leg, she could be bleeding into her brain. She is rushed to radiology, where a CT brain scan shows no abnormalities. Green has a low-grade fever and shows no grip reaction in any of her hooves, which could be symptoms of acute mana poisoning. If a traumatic incident caused Green to exhaust her mana pool, she may be in a state of hypothalamazonia. Hypo meaning low, thalamazonia meaning related to the magical field. Low magical field strength. Green was found in the Everfree forest, a high magic environment, so there should be plenty of magic for her body to use, right? Actually, no. Before a pony can make use of ambient mana, they must attune it to their magic field and assimilate it into their mana pool. If raw ambient mana is drawn into the body, it interferes with a pony's metabolic processes in a life-threatening condition called mana poisoning. Ordinarily, a pony's own magical field will repel foreign mana, but if a pony enters a state of hypothalamazonia in a high magic environment, their thalamic pressure can drop below the ambient level, leading to a raw mana being involuntarily drawn into the body. An examination with a portable thalmatometer shows her magic field strength is at a normal level, so we can rule out mana poisoning as a cause. Meanwhile, Green's test results are starting to come back from the lab. They paint a picture of a pony in the early stages of acute starvation. When the body is deprived of food, the liver begins to break down fat for energy, producing ketones. This is a normal process that maintains the level of glucose in your blood between meals, but if ketones begin to build up in the body, they can alter the pH balance of your blood, a state known as acidemia. Acid meaning a lower than normal pH. Emia meaning presence in blood. Children are particularly vulnerable to this, which is one of the reasons it's not recommended for young children to participate in fasting. Acidemia could explain some of Green's neurological symptoms, but her presentation is atypical. Green is given an intravenous glucose and insulin infusion to prevent more ketones from being produced, along with other IV solutions to correct her deranged electrolyte levels. The results of Green's urinalysis show an elevated leukocyte level. Leukocytes are white blood cells, part of the body's immune response, and their presence in urine suggests that Green is suffering from an infection somewhere in her urinary tract, a UTI. Lack of hygiene in the wilderness combined with starvation-induced immunosuppression may have predisposed her to this type of infection. A minor disruption purge is used to purge any biofilms that may have formed by bacteria in her urinary tract, followed by a washout with frost blossom solution. Once cultures come back from the lab, a targeted course of antibiotics will be prescribed to kill off the bacteria that remain before they can recolonize. When the report comes back on Green's CT scan, stroke and bleeding into the brain can be ruled out. X-rays are taken of Green's broken foreleg and an orthopedic consultation is requested. The fractured bones have shifted out of position and will need to be internally fixated if they are to heal up correctly. The fracture has also resulted in a hematoma. Hema meaning blood and oma meaning swelling or tumor. Blood vessels in her foreleg have been damaged and are leaking blood into the surrounding tissues, which causes severe pain and, if left unchecked, can result in something called compartment syndrome, where the swelling inside a muscle compartment is so severe that it restricts blood flow. Green still has a strong pulse in the frog of her injured leg, so this has not happened yet. Nurses are continuing to observe her for a potential injury to her thalamic system as well, by assessing her hoof grip, but Green is either unwilling or unable to cooperate with the assessment. If her thalamic pathways are damaged, her ability to shape mana with the affected hoof could be permanently impaired. Meanwhile, Green's level of consciousness is improving. It's clear that her pain is severe. Doctors cannot give her any pain relief, however, since they're still trying to assess her neurological symptoms, and it would be impossible to distinguish the effects of the drugs from the symptoms that could indicate life-threatening complications. 2 hours after her admission, doctors determine that her neurological status is stable and give the go-ahead for her to be prepared for surgery on her foreleg. The orthopedic surgeon will be conducting a mana-guided closed-field relocation and internal fixation. Mana-guided closed-field operations are performed without cutting the patient's skin. Once the patient has been anesthetized, a thalamic resonator is tuned to nullify the patient's magic field within the area to be operated on, allowing a unicorn surgeon to both visualize and manipulate the organs and tissues within the patient's body. Once the bones in Green's leg have been aligned correctly, mithril wire is introduced by teleportation and anchored into the bones using screws. Mithril is an expensive material, but it's used in medical implants for its high thalamic permeability, which prevents disruption to the patient's magic field. The operation is a success, and after a short stay in hospital, Green will make a full recovery. Thanks so much for watching. Take care of yourself, and be well.
Dude, man goes above and beyond for what he works on, and you gotta give him credit. He's humble, hardworking, and has a very friggin' bright future ahead of himself. So please do give this guy some love in any way you can, because he deserves it.